Hello, friends. Welcome back. I'm Lalman again, and today we are going to talk about gout, a hyperuricemia condition. As you all know, gout is an inflammatory disease triggered by uric acid crystals being accumulated in your joints, particularly on your big toe, ankle, wrist, elbow, and so on. If you look at it, the primary reason for the high uric acid is either overproduction or the under excretion by the kidney, apart from any defect in genetic. Now, to rule out any kind of kidney defects, probably you can check your 24 hours urine uric acid, and if it is low, probably you can confirm it by checking serum creatine or the blood urea nitrogen, or any traces of albumin or blood in your urine, or and GFR rate. And then still concerns, probably you can consult a nephrologist to further rule out any CKDs or any other complications. All right. Since in majority of cases, particularly in youngsters, the overproduction could be the real culprit, and so let's focus on that right now. All right. So overproduction can be of two ways: either by eating food containing high purines. Usually, the doctors say high protein causes uric acid. However, it's not the protein, rather the purine is what causes high uric acid. Foods such as red meat, internal organs, seafood, particularly shellfish like shrimp, crab, or fishes like sardine, mackerel, certain vegetables like mushroom, cauliflower, yeast, and of course alcohol, particularly beer, causes high uric acid. However, I do not recommend you to stop these foods, rather advise a caution, because diet is not the primary reason for gout. And moreover, what fun in life without eating your favorite dishes, right? All right, so now the major cause of hyperuricemia is purine that's been produced inside our body. So let's understand what is purine all about and how does it produce uric acid. Purine is an essential part of our genetic code. Purine is a heterogeneous base, and it is a building block of our RNA, DNA, along with pyrimidines. Essentially, purine consists of 4 different nucleotides, which are the part of DNA and RNA, such as adenine, guanine, hypoxanthine, xanthine. And the catabolism of these 4 different nucleotides finally leads to uric acid. Let's understand further how does it happen. During the course of the purine breakdown, adenine will get deaminized into hypoxanthine by releasing an ammonia molecule, and then to xanthine. In case of guanine, it will get deaminized again into xanthine. Here again it releases another ammonia molecule. And finally, this xanthine oxidizes to form the uric acid. And we all know that since DNA and RNA are an integral part of all cells, any kinds of damage to these cells and subsequent recycling of those cells in spleen leads to high purine in body. So essentially, more the damage, more the uric acid. Right. So now let's see what causes all this cell damage inside our body. Certain bone marrow defects or certain cancers like leukemia can cause high cell turnover. Cancer treatment like chemotherapy can induce high cell damage. However, another major reason for high uric acid is psoriasis, an autoimmune skin disorder. In a normal person, the skin cell will usually take around 28 days to complete its life cycle. However, in case of a psoriatic patient, it could hardly take 4 or 5 days. This leads to very high cell turnover and invariably high purine and uric acid. Quite often, the psoriasis might not manifest itself and you cannot see any symptoms, rather it will be hidden inside. Certain infections such as streptococcal bacterial infection can trigger psoriasis. But then how do we know if you have a hidden psoriasis? I can give you some tips. For that, check if you have a heavy dandruff that needs a daily shampoo. Check your ear lobes for any scaling or patches either inside or back side of your ear lobe. And of course, if you have any chronic back pain, say at L4 to S3 range, or particularly at your SI joint, that's on your buttocks. If so, then you probably are prone to the gout because you may have an internal low range psoriasis. So now let's discuss about the treatment part of gout. Right. Since gout is the most painful arthritis, the first line of treatment is all about the pain management. And once the pain gets over, once soon after that, the prime attack, put an ice pack on the site to reduce the inflammation, and of course, drink lots of water. Then you may use any NSAIDs such as diclofenac, which can have a moderate impact on the pain. And whenever you take any of these kind of NSAIDs, remember always to take a proton pump inhibitor, because this COX-2 inhibitors always try to damage the stomach lining. Okay, so yeah. Now, even after taking diclofenac, still if you have pain persists and heavy pain, you may probably go for a more effective colchicine. And usually it takes a couple of days to get rid of this pain. Fine. It comes to the real treatment part. So far we managed the pain. Now let's get rid of our high uric acid in our body overall. It could be in the joints, it could be even in the kidney. So here the intent is to break or alter the pathway of the purine catabolism. The treatment can be either a pre or post uric acid conversion. That is either stop the conversion of xanthine to the uric acid or instruct the kidney to excrete more this uric acid by probably inhibiting the reabsorption in the convoluted tubes in nephron, particularly at the more acidic region of the distal convoluted tube. Fine. Now, if you ask me, I would prefer the first approach by inhibiting the uric acid production itself, because this ensures less stress in the kidney. So for that, we might have to use a xanthine oxidase inhibitor to stop the conversion of hypoxanthine to xanthine and then xanthine to uric acid. And for that, allopurinol is one of the most common xanthine oxidase inhibitor commonly used across the globe. I think allopurinol has been in use since 1960s or so. So it's well tolerated medicine and doesn't have too many serious side effects. However, if you are a young man and face any kind of fertility issues, post long-term use of allopurinol, probably you can temporarily stop it for a couple of weeks and then you can continue. But trust me, there's no concrete evidence of any such impact of allopurinol on fertility, but just a very, very remote chance I'm just trying to highlight. That's it. So ideally, the allopurinol treatment should start a week after your gout attack, once the pain management is done. And initially, start with say 100 mg dose on a daily basis, and it should be taken after the breakfast with a full glass of water. And a month later, check your serum uric acid, and if required, increase the dose to say 200 mg, and then probably to 300 mg per day. And thereafter, you can evaluate your serum uric acid on a regular basis, say 3 months, 6 months, or 1 year frequency, and then you can readjust the dose accordingly. At any case, never exceed the daily dose of 800 mg, because it can strain your hepatic cells, and it could be toxic, right? And of course, try to have a single dose per day and in the morning. Interestingly, the initial allopurinol treatment may trigger a couple of mild gout attacks, and this is pretty much normal. And make sure you continue taking your allopurinol without any break. Usually people try to discontinue, or they will probably discontinue since they get the gout attack while taking this medicine. So please don't do that. Another thing is be careful, careful, and you need to strictly monitor your vital functions in case if you have say kidney or thyroid or liver problems. Okay, that's one thing you need to find. And finally, a couple of crucial points to keep in mind about the gouts are avoid dehydration and drink lots of water, at least 2 liters per day. And understand that your diet is not the primary cause of gout, though it can be a secondary cause. I think that's it. Thank you so much, and hope you guys enjoy the session, and we'll meet again with another interesting topic. And till then, goodbye.